All right. Hi, I'm Dr. Vickers. I'm a triple board certified dermatologist and Mohs surgeon, and today I'm going to answer your most Googled questions about hair loss. First, I'd like to say if you found this video because you yourself are experiencing hair loss, I am really sorry. It's a truly stressful thing to go through and made so much worse by not knowing what's going on and why your hair is falling out. So hopefully, one of my goals in this video is to kind of explain a little bit about what's going on in the different types of hair loss and what you can expect and try to relieve some of that anxiety around it. And along those lines, I like to mention to as many people that will listen that TVs and movies love to show that the character is in trouble medically or something else is going on with them by making their hair fall out. And it's a great device for a visual media because it is very dramatic and it clearly demonstrates what they're trying to show. But in the real world, like many situations, it doesn't really follow the movies. And in the developed world, at least, hair loss really has nothing to do with your internal or overall health and falls out for very different reasons. So I know you know this, but just a quick reminder that movies and TV shows are a visual media trying to demonstrate things and convey their story through dramatic images and not a very good source for medical advice. No surprise, I know you know that. First question, why hair loss with Ozempic, Wegovy, Zepbound? Why hair loss after pregnancy, during menopause? Why hair loss with weight loss? So I'm going to group all of these together because though the details and the specific scenarios can vary widely, they all come down to a common denominator or a common cause that we call telogen effluvium, or most people would say stress-induced hair loss or stress-induced hair shedding. So your hair all over your body is constantly going through a hair cycle with a major growing phase called anagen, a stopping phase called catagen, and then finally a phase where the full-length hair is released and everything starts over again. And the cycle happens for different durations in different areas of your body, which is why the hair on your scalp can grow much more than your eyebrows or your eyelashes. On your head, normally, the great majority of your hairs are in the anagen or growing phase, where they stay for most of the time, and only a few of them enter the telogen phase at any given time. However, if there's a major stressor to the body, especially if it results in significant changes to hormones like cortisol and estrogen, this can influence the hair cycle such that, critically, several weeks to months after this event, there is an increase in the number of hairs that enter the telogen phase and let go of the fully grown hair. And we don't fully understand all of the dynamics at play here, but we do know it can result from a great range of events commonly associated with hormone changes, such as estrogen in pregnancy and menopause, or cortisol from the stress of illness or even intentional weight loss, and even psychological stress from students going through final exams. So the way in which the hair falls out is the most telling for this disease. Most people notice an increase in hair in their pillow after sleeping, or on their hairbrush when they brush their hair, or in the shower as they wash their hair. And long hairs that have been let go by the scalp are collected during these activities and become visible. Usually, at this point, patients notice. And I'd say the most important thing to know about this disease is that although it's very slow, and always more slow than you would like, it does recover and return to normal. And all the machinery to make hair is still intact and has not been destroyed. It just takes months for things to stabilize. Also important to know is if these hormones or other stress factors continue or come back, this can even further prolong the increased shedding phase. So because these are full-length hairs coming out, they can be really long and take up a lot of space, making it look as though a lot more hair is falling out than it really is. And lastly, even though you, as the patient, see all of this hair coming out, it's usually very difficult for anyone else to notice a difference in your appearance. Again, because of the space-occupying nature of hair and the fact that these hairs are being let go in an even distribution throughout your scalp, the overall volume of your hair does not reduce nearly as much as you might think, and there are no bald spots or other obvious signs of hair loss. So for most patients, it comes down to doing my best to explain the process and what's going on, convincing patients to give it time to settle and let everything go back to normal. And if I could provide any validation, it does suck. It sucks. There's no way around it. It's not fair that I'm telling you that your hair is falling out from stress and there's nothing you can or should do for months, except watch it continue to fall out and do your best not to stress, because stress will make it worse. And it's not fair. It's not. But as a helpful reminder, I hope you can hopefully focus on the fact that this is a non-permanent form of hair loss, and all of the hair in pretty much every situation does come back, in contrast to a lot of the other types of hair loss that we'll see in this series. Okay, why hair loss in men? Okay, well, there are many types of hair loss that men can get. I guess all of the types of hair loss men can get, but I'm assuming we're talking about the most common type of hair loss, which is male pattern baldness, or what the technical term is androgenetic alopecia. And it's scientific, but it's actually a rather good name for it because it describes pretty well what's going on. So andro, meaning related to hormones, specifically testosterone and related molecules. Genetic, because it's almost entirely due to genetics, and hence the pattern of male pattern baldness, meaning a genetic pattern. And alopecia, which just means hair loss. So this type of hair loss is well known, and although it can affect both males and females, it's by far more prominent in males and more noticeable in males, and typically has a different pattern in males and females. So the classic story is that this starts as thinning and eventual hair loss of the hair on either side of the front hairline and on the crown of the scalp, and then generally expands over this area to eventually cover the entire top of the scalp, and typically spares the hair on the back and sides of the scalp, just above the ears and on the back of your head. And interestingly, for females, for reasons we don't 100% understand, this tends to be overall much less severe, and typically instead involves a thinning sort of Christmas tree pattern, or thinning along the midline of the top of the scalp running front to back. And the answer everyone wants to know, that we, or at least certainly I, don't understand completely, is why exactly this happened. And even though this is an incredibly common problem with an enormous amount of interest, the mechanism is still unclear and we haven't quite nailed it down. But there's a few things that we do know. It seems to be related specifically to a metabolite of testosterone called dihydrotestosterone. And evidence for this is the fact that the medication finasteride helps to stop progression, and finasteride blocks the conversion of testosterone to dihydrotestosterone. And we also know it has something to do with the androgenetic receptors in the cells, because this is where minoxidil is thought to help. And regardless of the molecular dynamics, the end result is that genetically predisposed hairs receive a signal, usually around your second to third decade of life, to start transforming from full-thickness, mature, or terminal hair follicles into much smaller, almost invisible hairs known as vellus hair follicles. And although there isn't anything inherently or necessarily destructive or irreversible about this process, for whatever reason, it's incredibly difficult to try and stimulate these hairs to go backwards, to go from the vellus hair and go back into a fully matured state, or a terminal hair. And we also know that it seems that these hairs are programmed to have this behavior based on their location on your body, and that this programming takes place very early in your life, maybe even in the embryonic stage. And the evidence for this is that if you take hair follicles from elsewhere on your body, even just a few centimeters from the affected areas, and transplant them into the scalp areas that are affected by androgenetic alopecia, they do not undergo this transformation into the shrunken hair, and they stay this full terminal hair. So things that I wish everyone knew about this, the two main medication treatments for this type of hair loss are oral finasteride and topical minoxidil, and these are the tried and true treatments. But it's important to know that these are best thought of as freezing the process and not reversing or regrowing hair, despite how many products or services might be advertised to be able to do so. They must be continued to maintain the hair that you have, and when and if you stop the treatment, typically the progression starts again. And it's not fair by any means. But unfortunately, we're fighting against the genetics of your body, which is a tough battle. And the only meaningfully way that I'm aware of that I would suggest for somebody to regrow hair in a place that's already been lost due to this process would be to transplant the hair and take it from elsewhere on your body and move it into the areas that no longer have hair. All right. Is hair loss reversible? I think anything hair-related, this is the top question on anyone's mind, at least when they come in to see me. So we already talked about telogen effluvium being reversible all on its own with time. androgenetic or male pattern baldness alopecia being irreversible to any significant degree without a procedure. But there are many other types of hair loss, both reversible and irreversible. Typically, a hair loss appointment eventually comes down to identifying what type of hair loss that we're dealing with, and we can predict how it's going to behave once we have that nailed down. And it'll be a little bit tricky to fit everything into a short little video, but I'll try and get some highlights and give you some examples of the types of hair loss that we would be looking out for. So the most important thing to help you get the right diagnosis 99 out of 100 times when you're dealing with hair loss is going to be, I guess, first the pattern of hair loss. So where on the scalp or anywhere else is the hair being affected, and the history of the hair loss and how slowly or quickly it's been progressing. And you can certainly do things like a biopsy of the scalp where you take a little piece of hair and you send it off to the lab to look more closely at the hair. And I feel it's important to say this is rarely needed to make a diagnosis and is usually done to either confirm our suspicion of a diagnosis or in complex cases where you think there might be multiple things going on at once and you want some evidence to support that. So, for example, a relatively common pattern of hair loss is called alopecia areata, and it's characterized by discrete, well-defined patches of hair loss that appear overnight or very quickly. And the underlying cause for this one is autoimmune, meaning that for reasons we don't fully understand, some inflammatory cells decide to get a little trigger happy and swarm the base of fully grown terminal hairs, typically in one or more patches throughout the scalp and or beard area, which immediately launches these hairs into their telogen or shedding phase, and the hair shaft is let go. And fascinatingly, well, I guess fascinating to me because it's not actively happening to me, but interesting, maybe is a better word. This process only targets hair with pigment and spares gray hairs, leading to the phrase white overnight as a way to describe this phenomenon. Now, there is some good and bad news about this type of hair loss. The good news is that mild forms of the disease, where a few smaller patches show up every so often, is almost entirely reversible. And this is a non-destructive T-cell focused inflammation that doesn't destroy or scar the hair machinery. By either waiting for the inflammation to go away on its own or trying to speed up the process by injecting steroid into the area. Once that inflammation goes away, the hair is allowed to resume its normal hair cycle and will eventually replace all of the hair that fell out. The bad news is that there are forms of this disease where the inflammation is more persistent, and it can be very difficult to get this inflammation to calm down and go away. And the more advanced and widespread the process is, especially if it grows to involve the entire scalp or head, or even hair on other parts of the body, in conditions termed alopecia totalis and universalis, the less likely this inflammation is to go away on its own, and the more difficult it is to find safe and effective treatments. But I will say that this is an area where actively, at this very moment, there are new drugs that are coming out and being studied that have promising results. So I hope that everything I'm saying about this is outdated in the near future, and we have great treatment options, but we're going to have to see. But if that interests you, talk with your dermatologist. Some other forms of irreversible hair loss that I really wish more people knew about include something called traction alopecia and centrifugal cicatricial alopecia, which I have to look up the order of the C words every time. There's just too many of them. Anyway, CCCA for short, despite being a mouthful, is an accurate name for the process. It's central, meaning it affects the center of or crown of the scalp. Centrifugal, meaning circular or specifically expanding away from a central point. And cicatricial, meaning scarring and therefore irreversible. And alopecia, again, just means hair loss. And traction alopecia is a related scarring hair loss that typically affects the edges of the hairline and shares many of the same risk factors, but it remains unclear if it's exactly the same process or if there are some differences. But what we know is that both diseases share prolonged tension and pulling on the hair root as the biggest risk factor for developing the disease. Statistically, these types of hair loss are more likely to form in those with very tightly coiled hair, can be more difficult to manage, and is more likely to be pulled into tightly wound hairstyles and braids in an attempt to control it. And we see evidence of this in the areas that the disease most commonly affect, including around the fringe or edges of the hairline that would be under the most tension from hairstyles that either pull the hair up in braids or ponytails or pigtails, and centrally on the scalp for CCCA, thought to be related to these factors as well as heavy hair prosthetics that might pull most strongly on the center of the scalp, and attachments such as extensions, beads, clips, wigs, sew-ins, and so on. Very slowly over a very long time, like decades, increased tension on the hair follicles leads them to scar over, and all of the hair machinery eventually becomes completely replaced with scar tissue, which is permanent and prevents the hair from ever growing there again. And unfortunately, this is another disease that doesn't play fair. There are plenty of people that have very tight hairstyles and put all sorts of heavy extensions and prosthetics in their hair for their whole life, and they never develop this disease. But there are some that do that and develop it very early on. And there's almost certainly some other genetic or undiscovered factors at play here, and likely has something to do with certain genetics that make you more prone to a certain type of scar formation. But I do think it's an important type of hair loss that I'd like to have more awareness of, because it does seem that reducing the tension and being aware of tension being the root cause will help limit the progression or completely stop the progression of this disease. And because this typically happens very slowly over decades, it can make it very tricky for patients to realize that the hairstyle might be a factor that's contributing, because it's hard to put together cause and effect over something that happens so slowly over such a long time. So I typically ask my patients with this disease, simply think about this and the hairstyles they've had over the years, and try to find a good balance between looking awesome and confident and having the hairstyle that you want and are proud of, and trying to balance that with the known risk of tension, and doing what they can to reduce the tension of the hairs on the scalp, which can range from braiding the hair a little looser just at the scalp, as if it was a week or so old, to using lighter weight or fewer beads or clips and prosthetics, and making sure that when you use any wigs or sew-ins or extensions, that they are attached in a way that distributes the weight as much as possible to as many different points throughout your scalp, to avoid putting all of that tension on just a few hairs or a small patch of hairs, as that's going to put them at the highest risk for abnormally high tension. All right, so that is all the time that I have for hair loss at the moment, but if I missed your question, let me know. I'm happy to do more. And once again, if you're watching this because you are actively or currently going through one of those types of hair loss that we mentioned, I'm sorry. I know it's incredibly stressful, and I hope that I can at least provide a little bit of relief by explaining what's going on and giving you some insight into what's going on underneath.